We are dedicated to promoting world peace and harmony through daily breath energy practices and breath mindfulness session, accompanied by educational talks that brings valuable insights to many. In addition, we offer free yoga sessions, including chair exercises. We are grateful to all those who contributed to this achievement, including PSSM, Tamil Europe, PMC TV, YouTamil TV Germany, and PSSM Global. We truly appreciate your presence and dedication. Now, I will hand over the platform to Mrs. Arundhati Srikandaraja to conduct the meditation. Thank you very much indeed.
Thank you. Greetings to all. The purpose of meditation is to train our mind to use it effectively and efficiently in our daily life. Meditation can help us to get rid of tension and to find relaxation. Meditation can calm and help us to find peace of mind. It doesn't require a specific spiritual belief. Anyone can practice meditation. It's very easy to practice. One needs to be mindful of our natural breath. Breathing should be natural. Just breathe in and out. When we are with our breath, our mind becomes empty. Once our mind becomes empty, the cosmic energy starts entering into our body, and our performance level will increase, and we will be able to deal very effectively with any situation in our life. Now we will get into meditation. Take any comfortable posture. If you are wearing a glass, please remove and keep it aside. Drink lukewarm water before and after meditation. It avoids dryness of your throat. Now sit comfortably. Cross your feet like this. Interlock your fingers and place it on your lap. Gently close your eyes and observe your normal, natural breathing. There is no need for any deep breathing. Focus on your breath. Whenever thoughts comes, please come back to your normal, natural breathing. Relax the body. Keep the body still. More you relax your physical body, you go deeper into your meditation. There will be a background music to relax your mind. We will do the meditation for 25 minutes. Thank you. Please come back to your normal awareness. Unlock your fingers and place your palm on your eyes for 5 seconds. 1, 2, 3, 4, 5. Now remove your hands and look inside your palm, and we have done a meditation, and we'll thank all the friends who have participated in this meditation. Thank you. Thank you. Thank you.
Thank you. We thank everyone who took part in our joint meditation today, focusing on peace of mind, psychological healing, world peace and harmony with the blessings of the cosmic power. When we meditate together, we generate a powerful social force of oneness that spreads across all nations, promoting peace, harmony, and well-being for everyone worldwide. Our sincere thanks to Mrs. Arundhati Srikandaraja for leading today's meditation, and Mrs. Siva Mohan Master for providing calming music and displaying all the posters, and Bhavani Vigneshwar Master for recording this session. Special thanks to World Peace Forum, PSSM Tamil Europe, and PMC TV, part of PSSM Global, for their continued support. May the whole world be blessed with peace, harmony, prosperity, and well-being. And now it is my joy and privilege to say a few words about our speaker today, Dr. Judika Ravindran. I'm delighted to introduce Dr. Judika Ravindran, Principal Clinical Psychologist at the Scottish National Burns Unit and the West of Scotland Plastic Surgery Unit, Glasgow Royal Infirmary. With over 10 years of experience in NHS mental health services and with personal insight as a former young carer, Dr. Judika brings not only deep clinical expertise, but also a rare empathy and understanding to her work. She's also founder of the UK branch of ANBU UK, an organization dedicated to raising awareness of childhood sexual abuse within the Tamil diaspora and supporting survivors. Her tireless efforts reflect her passion for breaking the stigma surrounding mental health in the Asian community and beyond. Today, Dr. Judika Ravindran will speak on the topic psychological therapy in practice. Judika, the platform is now yours. Thank you very much indeed. Thank you.
Thank you for that lovely introduction. I'm just going to share my screen before I start.
I can't hear you properly. A bit louder, please.
Can you hear me better now if I speak closer to the mic?
Yeah, closer to the mic. Yeah, that's good.
Sorry about that. I'll just share my screen. I think that's the right one. Okay, just go to the beginning. Okay. Can everyone see the screen properly? I can't see anyone anymore, so I'm just hoping.
Yeah, we can see your screen, but the thing is your sound is not it's not loud enough. Can you make if you can put your volume a bit higher, then.
My volume's at the highest at the moment.
Now it's coming better now.
I'll just speak more closer to the mic.
Yeah, that's fine. Yeah.
Okay, so can you all hear me and see the presentation? Okay?
Yes, we can. Yeah, thank you.
Okay, so thank you very much for welcoming me into your space this evening. As Uncle said, my name is Judika Ravindran and I'm a principal clinical psychologist based in Scotland. Today I just want to talk about the basics around psychological therapies available in the UK. I'm aware that we have an international audience. There should still be the same therapies available, however, how one would access these therapies may vary. I'll try to stick to what I know so that I'm not sharing misinformation. I'm going to aim to keep it quite simple and practical so that you can understand what the therapies involve and why they can be helpful. We'll also look at some of the barriers that South Asians, especially Tamil people and people in our communities, struggle with when it comes to accessing psychological therapy and the services available. So I'm going to start with a quiz, or just a opinion poll. If you can use your phone, you can just go to the camera function and you can hover the phone over this pattern and it should take you to the website. And I'm just going to stop sharing the screen so that I can coordinate this. So I'm just going to come out of this screen and then come onto the... Sorry, so some of you may not have got that, so let me just put that up again. If I could just get a few hands up to say that they
You
have.
want us to take the photo of that, is it?
If you just open your camera and you can just
Yeah.
hover the phone over the pattern, it should send a link to the website, or you can enter the website into your phone, into your web browser.
Okay, yeah.
I'll just give you a few more minutes. I'm hoping by now some of you are on the website. So I'll just stop sharing. Is that okay to stop sharing the link?
Yeah, you can slide.
Okay, and then I'm going to share the, 1 second. There we are. Okay. Okay. So the first question, which I hope you can see on your mobile, and you can enter anonymous answers, preferably, is if someone suggested trying therapy, what would you think? And we're thinking about ourselves here. So if someone said to you, maybe you should try seeing a psychologist or a therapist, what would you think about that idea?
Usually trying therapy. You have to write it here, you have to say it to you.
You can write it.
Or we can say it to you now.
Yeah, you can also say it to me. I think the idea is to get a bunch of people to respond so we get
Yeah,
everyone.
if someone is suggested trying therapy, what would you think? First, I will ask, what is it for? From where it's coming? I'll ask the question first.
Okay.
And what is for? Why, if somebody is asking you, you don't know why they are asking, what is the purpose of, that's what I will do.
Fair question. Why do I need therapy, basically?
Yeah, basically, why do I need a therapy?
Yeah.
Yeah.
Any other suggestions? So we've got here someone in the audience is a psychiatrist, so they've answered that it wouldn't be appropriate for them. Fair enough. Any other suggestions?
Because all are muted, then we have to, so unless they raise their hands.
Yeah, or if you can type into the website, that's probably the quickest way so we can see everyone's response at the same time.
Yeah, but we don't know whether everybody, can you see how many people have been?
Yeah, so we've got 6 people on there so far.
Because, some people, I don't know whether they have joined this, they got the website.
That's fine. If anyone wants to unmute and answer the question, that's also fine. Okay, I'll move on to the next one.
Yeah.
So the next question, which should come up on your mobile phone, or if you like to speak out, you can also speak out, is why do you think our Tamil community are less likely to attend therapy?
Because they will think why, because of they think, they are worried about the relations or about their community, why these people are going for therapies and things like people can talk about. So
Absolutely.
that's what I'm thinking. I don't know.
Think someone else had their hand raised as well?
Yes.
You can unmute them. If somebody is raised, you can unmute them.
Yeah.
This is Kularatnam. I think our community probably they don't actually fully understand the how it actually would help them. because normally they actually think, just a medication will actually do all the work. And on top of it, after coming to, anyway, I know your mom very well. Your mom actually sent me your invitation as well a couple of days ago. I'm an accountant, and she actually was part of my AET community.
Okay.
By the way, yeah, I think most of the people actually think just taking medicine is actually help, but in fact, 94% of the healing is, you have to do it yourself, and the therapies always will help. I mean, a few months ago, not few months, 6 months ago, I sit and work all the time as an accountant, but I had a severe pain in my right hand arm. And when I went to the GP, they don't actually do any sort of, physio or anything, therapies. Therefore, I had to go private. And without that help, probably, I was in shock. I couldn't even move my hands, nothing. And I thought, I can't even drive my car. It's only the therapy, physiotherapy actually helped me. And the trouble with that nowadays is NHS used to do the therapies in the GP surgeries, but they don't do. They just give a leaflet. Therefore, the people actually, they don't actually understand how important the therapies will help. And there are therapies for each and every, people have lots of issues, even speech, starting how to deal with day-to-day issues. Therefore, therapies are there, and that this we need to make each and every one aware of. There are facilities available, there are information available, and each and every people.
So that's what we're absolutely agree with you. So there's different types of therapies. I guess today we're talking about psychological therapy, but there is physiotherapy, there are speech and language therapies as well. And you're absolutely right. Sometimes it is about making use of what's available to you. So thank you very much for that feedback. I just have one more question, which is, what do we all think is the rate of people experiencing suicidal thoughts? So we've got 1 in 10, 1 in 70, or 1 in 5?
1 in 70.
1 in 70, okay. Any other thoughts?
No, 1 in 10, 1 in 10, sorry. 1 in 10. I got it wrong.
Anyone else before I tell you? There's people in the chat as well. People may say mental, yeah. Sorry, I'm just noticing the comments in the chat as well, which I will come to. So the actual answer for that is 1 in 5.
Oh, 1 in 5.
So it's really quite.
There are some messages in the chat box as well.
Yeah, she knows that.
Judika.
Yes, I can see that. Yeah. So someone has said 1 in 10. So it's actually 1 in 5. So I'll just stop sharing that and come back to the presentation. Thank you for your contributions. So that's something I thought would help us to just get into the zone with this. Sorry, let me just try and get this to work. There we go. Okay. So the first issue, one of the issues we spoke about already, is why our Tamil community may struggle to access therapy. And one of the things that was already discussed, which is really helpful, is the stigma around mental health. Generally speaking, there's a lack of understanding about what is involved in having a mental health diagnosis or how this can develop. It's often seen as shameful or a sign of weakness, and can be a source of dishonor for the family. So the idea of, like Auntie said earlier, people learning about someone having a mental health diagnosis. There are so many different types of mental health diagnoses, and some are very severe and some are very common and normalized, like low mood or depression or anxiety, all the way up to things like schizophrenia or bipolar disorder. often in our sorts of communities, South Asian communities, we often see communities preferring to seek support from family or religious leaders. And this can often be because that's a more trusted source of support, or it's just what the family knows, and that has to be respected as well. But what I would preface that with is being able to understand whether or not you can trust that support, whether that family or religious support is able to give you the words of encouragement or point you in the right direction that you need at that time. And feeling safe as well. Often there's a struggle around confidentiality. And if you do go to religious sources of support, such as I did some brief volunteering in Sri Lanka, and I did notice that often people experiencing mental health problems would have several pusas in 1 year, but that wasn't actually addressing the problem at hand. But it made the person feel secure and it made the person feel calm, which of course is a benefit. So there's pros and cons to that. Thirdly, especially in the West, we have issues around language and cultural barriers. So the idea that if you go to your GP or you go to a mental health practitioner or psychological therapist, especially if they're maybe white, we do see a lot of people, I've had a lot of discussions with people saying they're not going to understand me because they're not going to understand my culture, or that I don't know how to express how I'm truly feeling in English. And there is help available for that, but not knowing how to ask for that help. So within our services, there will always be interpreters available. But then there's the issue of confidentiality, which is the next point, where people are very worried about who knows what. And for example, if the interpreter is someone you might recognize, that could make you feel very unsafe and feel as though you don't want to continue with the therapy. Also, you may be wondering, what if I go and see a therapist and I'm in the waiting room and I see my cousins, or I see, someone I used to work with, just seeing me walk into the building. So there's lots of things around confidentiality within our community, as well as being seen to be accessing the support. And lastly, there's also, I guess, a general lack of awareness around what is available. So I think that was also mentioned earlier. Where can I actually get the support I need, where I can feel like I'm being heard, where I feel like I feel safe to talk about my difficulties, and that I won't be judged. So we'll be talking about that today in this discussion as well. And of course, if you have experienced sort of discrimination within, whether it be the workplace or in the NHS or within other health settings, you may not feel comfortable to go and access support from the same institution, which is, again, completely understandable. With all these difficulties mentioned, these are very true, but there is now a lot more awareness within the NHS, at least, and hopefully within other psychological services across the world. There's more sensitivity brought to these issues. And if it's raised as something you are struggling with, the practitioner you meet, the clinician you meet, should and has a duty of care to ensure that these issues are addressed. So, for example, if you were worried about being seen, there are ways around that, whether that be a video call instead of an in-person session, or going to a location where there are less people that will see you, or asking for an interpreter, or you can even ask for somebody who is from the Tamil community or someone who is Asian, someone you might feel more comfortable with. It's not a guarantee that that's what will be offered to you, but they will try, and they will want to try and make your experience as easy for you as possible. So the next few slides are about the different types of therapy you can access, type of psychological therapy, and it's just a brief overview of what that involves. And I'll also be talking about the difference between a psychologist and a therapist. I don't think many people know the difference even within our profession. So yeah, I'll have room for questions at the end. So yeah, if you have any questions, just note them down. So before we get into that, I just wanted to explain, what happens in the first appointment. So you've gone to your GP or you've gone to your family doctor, or you may have asked for a private therapist. What can you expect? So firstly, the most important thing is that it's a chance for you to get to know your psychologist or your therapist. They'll be very interested in what has happened for you to want to come here. So has there been a trigger? Often within our community, what we see is either people have lost somebody to bereavement, or they may be going through sort of physical health difficulties. So we don't see a lot of Tamil people explaining that they are depressed or that they are anxious. They are often saying, I've had really severe pain in my body, or I've had really severe headaches, or I feel like I can't breathe nowadays, without maybe making the link to stress or anxiety or low mood. So often that is what will be discussed in the first appointment. You'll also be asked if you've had any psychological therapy before, because we want to know whether that therapy was helpful, and we don't want to make the same mistakes from before if it wasn't helpful. So often we will ask about what psychological therapy you've had before. We'll also really be careful to go through the confidentiality policy and agree with you what you'd like to get out of therapy and what would be helpful. And really importantly, what your goals are. Why are you coming to therapy, but what would you get out of coming here every week or every 2 weeks? How can we help you get to that goal? And often it's by having that conversation that we can agree whether or not psychological therapy is appropriate for you at this time. For example, if you're coming with financial worries, talking about it might not be helpful, or having psychological techniques might not be helpful. What you actually might need is a financial advisor or support from a benefits office. And so it's just really important space to clarify what can we actually do to support you, and is this the right place for you? So the most common form of therapy that's offered by the NHS and other psychological services around the world is CBT. You may have heard this before, so it stands for cognitive behavioral therapy. It's really quite a simple principle, but essentially you're looking at your negative thoughts and cognitions. Cognitions is another word for thoughts. And you're trying to link that to how that affects your behavior, how that affects your feelings, and how we can break that cycle. So one of these areas, whether that be the negative thoughts or the negative behavior, are the two areas that we would focus on to try and break the cycle, to help you be relieved of such emotions that might be anxiety or feeling sad or feeling angry. For example, if you think I'm not good enough, or if I take myself, if I was thinking I'm not good enough, I might start to feel quite sad and anxious and avoid doing things that I enjoy, or avoid people, or avoid the tasks I need to do to keep myself going. So what CBT does is it breaks the cycle by challenging the unhelpful thoughts and learning healthier coping strategies. So for example, it may involve experiments, what we call them experiments, where we might come with you to, for example, if you're struggling to get on the bus, we might come with you onto the bus to see what is happening and to try and challenge you in that moment, to help you focus on what you can do in that moment to help you be able to get from A to B. It's quite practical, it's quite structured. It's usually about 12 sessions. I'm quite lucky where I work. I can work with people for up to 2 to 3 years. So I really get to know my patients, but in a general mental health setting, it would be about 6 to 12 sessions for about 50 minutes. So it's a very good form of therapy. You can also access this online if you just Google online cognitive behavioral therapy, or if you were to order a book, there's lots of great resources online as well for self-help, but you can also go to your GP and seek this support as well. The next one is acceptance and commitment therapy, which is one of my personal, it's one of the types of therapy I really enjoy using, especially in a burns unit where people are struggling to come to terms with scarring and how their appearance has changed. ACT is quite different from CBT, but it does come from the same school of thought. It uses, instead of changing our thoughts, it teaches us to accept that difficult feelings and thoughts will sometimes be there. So for example, if we took somebody who has arthritis and is struggling with the pain that they have every day, and they've tried physiotherapy, they've tried multiple medications, what ACT would do would try to encourage you to accept that that is part of your daily life and try to build other parts of your life that will help you cope with that negative experience. So you may be looking at, what do you value? So if it's a grandmother, do you value spending time with your grandchildren? Why is that? Why does that make you feel good? How can we incorporate that more into your life? Is that, do you want to maybe be around other people that can help you feel even better? So it's really practical as well. It sounds quite simple, but it takes a long time, I think, for people to learn to accept certain negative parts of their life. I am coming in and saying, you may have arthritis or you may have scarring on your face, but we need to keep going. And that can be really hard for people to accept and to hear. So it also uses mindfulness and meditation, much like what we use today, to help you stay in the moment so that you can go on living and try to not ignore your problem, but allow it to come in, accept it, allow it to be part of your life. And it allows you to just build a more meaningful life. The next one, which is another really powerful form of therapy, especially for our community, is family therapy. So this recognizes that our mental health doesn't just exist on our own in isolation. It affects the people we live with, it affects the people we care about. And also there may be multiple people in the same house with the same mental health difficulties. So this type of therapy involves family members in the sessions. It helps bring about improved communication, resolve conflicts, and build understanding across different generations. I personally really enjoy working with families because you can see where so many of the difficulties have come from, and you can work across multiple different age groups and learn so much about those separate individuals, but all together. And you can see everyone's face changing as they come to realize where the misunderstandings have come from. The Milan model I've mentioned there, that just means that there's the family, there's a psychologist, and then there will be another psychologist and another therapist, possibly, all in the room together. So it's a lot of people. It's quite resource heavy, which is why the NHS doesn't always offer this type of therapy. And the idea is that while the family is working together to try and understand what's happened, so particularly in the NHS, we use this for schizophrenia, bipolar disorder, more severe presentations. You can basically try and understand the dynamics within the house that are making the symptoms of the mental health disorder worse. And you'll have another group of psychologists looking and listening to the session, and they'll provide feedback to the family to say, this is what you've been saying to the other therapists, and this is what we would suggest would help. So it's quite a big group of people in one room working together for about an hour every week to try and sort through the difficulty. So it's really lovely for our Tamil community because it means that we can continue to learn from the model of, this is our culture, this is how we speak, this is how we show love. Because in our community, we don't easily say I love you very easily. So things like that can be really powerful to learn about in family therapy. Counseling. So I think a lot of people think when you say psychological therapy, they think counseling. Counseling is quite different to what I've discussed so far. So it's often offered by a counselor or a counseling psychologist. I'm a clinical psychologist, so I use quite structured forms of therapy. And it's quite science-based. And counseling, on the other hand, is more focused on providing a safe space to just talk about what's going on. So it doesn't necessarily provide the same structure. It's very much about what you're bringing. So you come into the room, you meet with the counselor will say, what would you like to talk about? And you talk about that thing. And the counselor will have ways to support you and give you space to explore that. And often it can be sort of problem solving what's going on, looking for practical solutions. And it can help you to gain clarity, make decisions, and it can be short or long term. So it's a bit different to the therapies I've mentioned, but it's again on offer through the NHS or your family doctor or through private services. Okay. I mentioned suicidality. I think a lot of people might be quite surprised that 1 in 5 of us, I can't remember how many people are on the call, but if you can imagine people on this call, if say there's about 70 people, just imagining that every 5th person on this call may have experienced suicidal thoughts in their life. It's very, very common. It does not mean that you have a mental health diagnosis or that you are suffering with a disorder. It can be very just spur of the moment, where you just suddenly feel like you don't want to be here anymore and then it disappears, or it could last for a really long time. Either way, I've put the details on the screen for people in the UK. I didn't want to put the details for other countries because I'm not too sure what the services are and I didn't want to spread misinformation again. But in the UK, if you are struggling, you can call the Samaritans or you can book an emergency appointment with your GP. One of the other things you can do is to just ask a family friend or someone you really trust, when I'm feeling like this, can I just call you? Can I just speak to you? And that's a really good way of just helping yourself in that moment. The other thing you can think about is ways to disengage when you are having those thoughts. So if you are feeling suicidal, what can I do around me? If you just distract yourself for about half an hour to 45 minutes, you will notice that the thoughts become quite quiet and they shouldn't affect you as much in that moment. But it's not a long-term solution. The long-term solution would be to go to your GP, speak to your doctor, and either ask for medication and therapy. So what the clinical guidelines in the UK say is that the best way to help someone with depression or anxiety is therapy as well as medication, not just medication. Medication will help with the symptoms, but it won't take away the long-term issues. It's not a long-term solution. So it's really important to try and get both. So I think that's me. I hope I haven't gone over time too much. Just to sum up, therapy isn't just for people who are in a crisis or who are suicidal. It's for anyone who wants to improve themselves. CBT helps us to change thoughts and behaviors. ACT helps us to live with difficult feelings. Counseling offers us a space to be heard, and family therapy just helps strengthen those relationships and helps us understand each other. But for South Asians, for Tamil people, we must also recognize that there are cultural barriers and work towards making therapy more accessible, inclusive, and stigma-free. So I really appreciate you listening to me today, and I'm happy to answer any questions. I see a hand raised. I'm just going to stop sharing before I answer questions.
It's a very informative speech, Judika Ravindran. Is really, really good.
Thank you.
Now, what we are going to do is, first we are going to have a feedback session in English. After that, will be Mr. Kumar Sami Pilla Master will summarize your speech in Tamil. அடுத்ததாக நாங்கள் குமாரசாமி பிள்ளை மாஸ்டர் தமிழ்ல பேசின விஷயங்களை சொல்லுவா. கொஞ்ச நேரம் நீங்க பொறுத்துக்கொள்ளுங்க. First we are going to have a feedback session in English. So first, afterwards, you can ask. Now you can ask any question first.
We would like to thank her for giving us
right,
this wonderful speech. So by clapping our hands.
Yeah, we'll clap for 30 seconds first of all. Enough for your good speech, you know.
Thank you. Thank you.
Thank you. Now, Mr. Kuganesan from Chim.
Hello. Hello. Thank you very much. Good evening, brothers and sisters. What a wonderful speech, madam. First and foremost, Dr. Ravindran chose a topic of immense relevance in today's world. Mental health is no longer a taboo subject. The content of both information and practice is very good. I appreciate how the speaker didn't just focus on theory, but shared real-life applications. You also briefly explained about CBT, ACT, family therapy, and counseling. This made a topic relatively reliable even to those unfamiliar with psychology. The structure of your speech was very clear. The introduction of therapy, the body explaining different types of therapies, and the conclusion called for more awareness and acceptance. I have no questions to ask. Thank you very much indeed. Thank you.
Thank you. I really appreciate it.
Thank you, Kuganesan. Thank you. Next, Dr. Jagannathan from East London. Thank you.
Thank you. First of all, thankful for Judika for the presentation. A few points to raise. One is I've been retired many years, some years now. CBT, I thought it's gone a bit outdated, and something called DBT. I forgot what the D stands for. Can you remind me what D stands for?
Dialectical.
Oh, yeah, something like that. Now, about the suicidal thing, a long time ago, when I was small, I read a book. It says, during a lifetime, if you don't have a suicidal thought, not active suicidal, but even at least thought about it, not even once, you're not a human being. That stuck to my mind. So when he said 1 in 5, that must be active thoughts. But everybody, when they're disappointed in love affair or disappointed in marriage, they do feel, is it worth living? So if you don't feel like that, you're not a human being. Number 2 is about the Tamil community. I'm glad you covered about your talk focusing on Tamil community, because one of the barriers you had also mentioned it, cultural and other belief, because they feel this is your bad time. So instead of going to the psychiatrist, they go to an astrologer. So that's the one point. Yeah. Lastly, this is a joke mentioned by another philosopher, Sadhguru or whoever. He says, if somebody says, I'm going to the ashrama, means for a retreat, for some personal translation, they say, what's wrong with you? I say, you shouldn't go to an ashrama. So it's all a taboo, isn't it? You shouldn't go for personal transformation. See, the word therapy, again, I came across a long time ago. Therapy is healing. The healing is just it's a process between two people. One is a person who needs help, other one is offering help. So that can be anything. Just a gesture or having a friendly listening, or even just touching them for comforting. It's all healing. But as you say, the word counseling, again, people often mistake, isn't it? When they say counseling means, oh yeah, that's all the treatment. That's only part of the therapy, isn't it? Because that is just for supportive. But if you want for personal transformation, you need a dynamic change, and that's where I think psychologists play a role. And that can be sometimes difficult, because you have to face the painful shortfalls, and people don't want to face it. So they sometimes are reluctant to go, I suppose. Anyway,
Yeah,
thank you very much.
that was really helpful. Yeah, so DBT that you mentioned, that's now more used for people with personality disorder.
Okay.
CBT is still the sort of main therapy,
Sure.
unfortunately or fortunately. But it's used in tandem with lots of things, and absolutely everything you said is very relevant to how our community feels about it. I think my main message is that if you go to a psychologist, it's not just talking. You need to be ready to change, and ready for
And
transformation.
then this phenomena called transference, people don't realize it. I mentioned it a number of times, isn't it? That happen. So they think, oh, this chap is trying to be like my school teacher, or so they transfer that figure into the therapist, and they often drop out because they don't like that. They don't realize there's a transference process that's going on. Transference means you're transferring somebody's image into the person who is trying to help you. The helper is trying to be like my teacher or like my uncle, and then they form a dislike. So that is called transference from one person to the other. Yeah. Thank you.
That's very key one. Yeah. Thank you very
Thank you
much.
very much. Yeah, Judika, can you check your mic, please? I can't hear you, very.
Was it
Yeah.
difficult throughout the talk?
No. Before it was okay. Now again it started.
Obviously, I think it's just I'm
You
not
can see
close
the
enough.
difference. Other people, when they talk, is very, very clear. Anyway, it's up to you. Okay.
Sorry about that.
Thank you. Next, we have Panjacharam Ayya from Sydney, Australia. Thank you.
Greeting to all. Today, our Dr. Ravindran has given a very good lectures to us. First of all, I was trying to enter your barcode and sitting, joining. I could not join, so I dropped it and I was listening. I could not join into your statistics. It was a little bit difficult. But I have got one question. When you speak, you are going mental therapy. So now I don't need mental therapy. I won't come. The moment mental is gone, then how they will come to you to get the therapy? So what is the use of mental therapy? So can you discuss this, please?
Is your question if you're not so somebody is feeling better after having had therapy, or someone is saying that?
No. What is he meant is if somebody is mentally affected, how can they come to mental therapy? That's the question, I think. Am I right, Panjacharam Ayya?
Yeah, you are right. You are right.
Yeah. That's what he is saying. Asking the question, if somebody is mentally affected, how can they go to the therapist? That's what.
Is that it's a good question. Sometimes that can happen, that somebody feels like maybe they can't trust anybody in the world, so why would they go and then talk to somebody that they don't know? But sometimes with it, that's where a psychologist can be quite a difficult job. Sometimes it means that you're calling somebody knowing that they are struggling, so you might talk to them for many months, maybe just once a month, just asking, how are you, on the phone? How are you doing? So that that person can get to know you and learn about you. And then if it's very important that for the patient, it's their choice that they're coming, that they're not being forced. So there are people that feel forced to come to therapy, and that's a whole ethical issue, especially for people who are in prison or who have to go to therapy because they're not allowed to see their children without having therapy. And they don't believe that they need therapy, so they just turn up because the court has told them that they have to turn up. So our job is to engage with that person very, very gently, maybe for 5 minutes at a time, just constantly going up to them,
Oh, yeah.
and saying, hi, how are you?
A little bit difficult. You had to spend more time. But how you will get thought, feeling, and action in this mental person? How can you decide?
It takes a lot of work with somebody for somebody who's very unwell. So if somebody is really, really, truly unwell, we would say, let's wait until the medication has taken some effect, and then we can meet with them once their symptoms have come down a bit. For some people, it's about gaining trust. So after they've got to know you, maybe you don't start the CBT straight away. You don't go straight to thoughts, feelings, and everything straight away. You spend a lot of time just laying foundation, trying to give them a space to just feel heard, feel loved and trusted and safe. And then you move on to that later on. So some of the people I've been working with for 2 or 3 years, it's only in the last year that we've really started the therapy.
Thank you.
It took a long time.
Thank you. Yeah. Thank you.
Thank you very much. Next, we have Kularnam Master from PSSM UK. Thank you.
Hello, Judika. It was a wonderful session. For your young age, you fully understand our Tamil community's issues, and you highlighted all the issues as well. That is wonderful. When you actually mentioned about temples and etc., they could actually help. Certainly, there is a big improvement. The temples in the UK as well. They are doing lots of service to take care of the people as well, like doing the blood test, therapies and things like that. Therefore, they are actually playing their part, especially like a Ealing Temple as well as the Wimbledon Temple. And the mental health, I think we got 2 therapists doing this platform, Mr. and Mrs. Srikanta Raja sir. They are like our therapists for all of us, and they are always there for helping people. And one thing we need to understand, each and every one of us doing a meditation, we all are part of the small group of therapists, because we when we actually talk, they can feel we love and care them. That is a starting point for the other people. I'm talking about, the people you meet. And there was a question from Panjansara Master, how to identify people actually have mental health. This is like a talking to the people. They start to have some sort of understanding. You are going to love and care. That way, they will talk to you and they can help you. And certainly, we all need to help our communities and other communities. The meditation is always help. That is part and parcel of people having a good mental health. Thank you for a wonderful session. Thank you for your time. Your great sort of knowledge and everything is so beautiful. Well done.
Thank you. Thank you.
Thank you very much.
Thank you. Next, we have Rajesh Sidham Master. You want to say anything?
Okay. Thank you, Srikanta Master. Good evening to all. It's a very, very useful session this evening, and I really, really enjoyed it. Honestly, I did enjoy it. The problem is, it is the patient's decision to get treatment. So you can't force a patient to do things. So if they go to you, the initial thing is to the doctor's surgery, GP surgery. They go to the GP surgery, they talk to the GP, they explain everything, and the GP's duty is to refer them to the psychologist, which is one of you. So if the patient refuses to go and see a psychologist, there's nothing you can do. You can't force a patient to go and see the psychologist. What do you think? We had some problem in the doctor's surgery I worked.
Mm-hmm.
She went with all the tears and everything, and then she really, really needed help. I was talking to her initially, and I put the call to the GP, and the GP said, I need about 20 minutes with this patient to talk to her and then refer her to the psychologist, to the hospital. So we did all the arrangements. She came and she saw the GP, and then in the end she refused to go to the hospital.
That
So what can you do?
a psychiatry, was that to psychiatry as opposed to psychology? They're slightly, so with psychiatry, so it sounds as though she might have been in a crisis or having quite a difficult mental health episode. And in those situations, if someone, it's a tricky part of our job. So sometimes if somebody is having a mental health crisis, that's the role of a psychiatrist to then assess that person and deem whether or not they have capacity, which is a big term, to then make the decision to whether they have capacity to make a decision to have treatment. And that's a whole other topic, and I'm sure I could spend hours talking about that. But in terms of therapy, psychological therapy, it's very, very important that it's the patient's choice, which is why I'm really grateful for this platform to talk about psychological therapy, because a lot of the time, especially for Tamil people, they may refuse because they just don't know what it is, or they think that it's going to be, shameful, or, why would I go and tell somebody else my problems, etc. So it's about trying to figure out why they won't go and have a discussion where, you can engage with them. So if in this GP's case, I would have been thinking, okay, I need to keep seeing her maybe every 2 weeks just for 20 minutes and try and understand what's going on for her. And maybe she won't go now, maybe she'll go in 5 years' time, or maybe she'll never go, but that has to be respected, because that means, in a way, and that's something that is a very hard pill to swallow sometimes, that patient has made that decision that they only want to be helped so much. There's only so much help that they are okay to receive, and any other help that they could receive, they're not ready for it. If we force somebody into therapy, it won't help, it won't work. And that's something we have to accept, unfortunately. So for the people who are ready for therapy and open to the process, it does wonders. Not for everyone, even then it still may not be helpful for various reasons. But most of the time, if somebody is ready to do the work and to turn up every week and follow the recommendations, follow the guidance, then it can be very life-changing. But but you're right. One of the main frustrations, especially for me, is when, especially from our community, if somebody doesn't go because they don't maybe understand what's involved, then that can be a barrier for sure. It's a very good point.
Thank you. Next, Arundhati Srikandaraja.
Yeah, thank you very much, Dr. Judika. Excellent presentation, and you have brought so many things to be aware of this, our community, how they are feeling. They are not open to the doctors or even therapies or anything. I want to ask you a small question about the youngsters. Youngsters, some they are very, they keep it they don't speak out to their parents or anybody. Sometimes when they speak to us, how can you advise them that they are fear of something, that their future, about their future and everything, even though they are a bit, how can I put it, even though parents advise them, they don't want to listen to the parents. But then when they talk to us, they speak in a different way, and it's very difficult to advise them. So in that way, what we can do? As a therapist, because you are psychological therapy doctor in that particular field. So that's what I'm asking you.
Are you referring to sort of grandchildren type?
No, because I got students, so many students. I teach music, so they talk to me a lot. So I advise them.
Yeah.
because they don't want to talk to their parents, so they talk to me when they come for the lessons and everything. So I do advise them, but it's very difficult sometimes in they are young and they are that's
Yeah.
what.
It's a
So
very
what advice you will give it to somebody that they are worried about their future, even though they are studying, they are not getting enough marks or anything to go to university, so they are worried about their future. That is the main concern to these children, youngsters,
Yeah, so
mainly.
I would firstly be very quick to normalize that feeling. So even just simply saying, of course you're worried about your future because it's important.
Yeah,
Of course this is very stressful, and sometimes just saying that alone can be really powerful because
yeah,
it informs the younger person that they're not alone, that they're not just, maybe they're not exaggerating, or they're not, they're being believed. So I'd really normalize that experience. I would then start to give them a space, I guess, to recognize that they're doing the best that they can, and to recognize where there's only so much they can do practically speaking, and then the rest is what we call a hypothetical worry. It's a very it's a difficult one because often how they're feeling is reflected by the system around them. So
yeah,
maybe their parents are the ones that are worrying, and so as a result they're worrying because they want to make sure that their parents are happy. So sometimes it's about, bringing those two groups of people together to talk together, to reassure each other,
yeah,
that that the parents know, okay, my children are doing everything they can do, and that the children are aware that the parents know that, so that they can hear each other and support each other. It is quite difficult, and it would probably the most important thing is that they feel heard and that they feel normalized, I think, on a teacher-student level.
yeah,
Because I think it's important to also protect yourself, so that the children don't come back one day and say, oh, auntie said this, and blah
yeah.
blah blah.
Because I know, because they don't want to say to their parents, but they say to their teachers. Then it's very, very difficult situation at that time.
Yeah. The most powerful thing in your position would be to normalize, give them a space to talk and hear themselves. And I think the rest is up to their school, it's up to their parents, it's up to the
Yeah,
wider system. And I would just encourage you not to take on too much of that responsibility.
yeah, that's what I do. Yeah, I do tell them, but I don't take too much responsibility. But I tell them, after all, they have to speak to their parents
Yeah.
mostly about, yeah.
Yeah.
Anyway, thank you very much. Thank you for your.
Thank you. Thanks very much. Next, we have Sugendra Dharmakumar. Please.
Greetings to everyone. Judika, it was really excellent speech. I just want to ask one question. How do you know when someone needs psychological help?
Yeah, that's another good question. I guess it's quite hard if are you talking about yourself, or are you talking about like a family
N-
member?
Anyone,
Any-
a family member.
Yeah. I think I think if you feel as though you are doing everything you can and things are not improving for you, so for example, you've taken the medication, or you've left the job that was really stressful, or you've maybe there was someone in your life that was bullying you or abusing you, or creating problems for you, and that's all been addressed, but you still feel every morning you're waking up and you still feel empty, you still feel incredibly sad, or you might not feel anything. Some people feel quite numb, or some people, they just stop doing things, like they may stop cleaning the house, they may stop going cooking, or they may stop seeing their friends. become very isolated. This is all signs that psychological therapy is going to be quite helpful. And it doesn't necessarily mean that it will all disappear straight away, but it's a sign that it would be helpful to talk to someone who's outside the family or outside your support network, and to have in those kind of situations, CBT is really helpful, or just counseling for some people is really helpful.
Okay, thank you very much. So that means you are saying that if they are not doing their daily activity like normal, that's also they need some help. Is it?
Yeah, that's a sign, I think, from the outside. But sometimes there are lots of people that, especially our Tamil people, we're very, very highly high functioning people because of what we've been through. We are always, aiming for the high achievements. So it's very easy to hide behind that, oh, I've got this meeting, I've got this degree that I'm completing, I've got lots of things. So sometimes even if somebody is still functioning really well, they can still go into their room and be completely distraught. So it's not always very obvious, but sometimes, not doing the things you enjoy, not connecting with people, not eating healthy, the things that make you feel like you're not yourself, that person isn't themselves, I think that would be a strong sign.
Okay, thank you very much. Thank you.
Thank you, Auntie.
And the time is 9:28. So Cognizant Master, please be quick. After that, Kumarsamy Pillai Master, they are waiting.
Yeah, I'll make it very quick. Yeah, the question is, Madam, you were talking about crisis. That's why I came now. If a person is in crisis, that person, I don't think the psychological therapy is not going to work straight away. I mean, I understand the psychiatrists need to be intervened by, the psychiatrist should intervene and take some medications. And unfortunately, I also understand that medications won't help much. I mean, perhaps it can be for 10% or so. Later, the psychologist like you to be intervened, but your intervention is almost 80-90%. Is it true? I mean, whatever I say.
I'm not sure, I wouldn't have statistics on hand, but from my experience at least, when someone is in crisis, so what we mean by crisis is usually quite varied. So someone could be feeling quite suicidal, or they may be unable to have any insight into their behavior. So they may be hearing voices or quite manic, these type of things that are quite severe. In that situation, medication is the first line defense. And in most cases, from my experience, it's quite powerful and it can be quite helpful. I don't know the percentage as such, but I wouldn't say it's as low as 10%. In my experience, it's a lot higher than that. It might be the case that someone might not respond very well to antidepressants, because that takes that takes about 3 to 4 weeks to work. So we usually would say to someone to try a small dose and then eventually go up. But I'm not a psychiatrist, so I shouldn't be talking too much about medication. But then the psychological therapy part would come later, after the symptoms have improved a little bit. Or even if you're continuing to feel suicidal, you can still access psychological therapy. There are therapies. There's one called, I'm really bad at it's phenomenological therapy. So that looks at the question of why somebody wants to exist. So that can be quite good for somebody who's suicidal. It just helps them to explore why they exist, what their purpose is on Earth. and that can be quite powerful. So it depends on the person is the short answer, really. Some people are ready for therapy, some people are ready for medication, they want everything, they want all the help, and some people you know, they just aren't ready for that yet, and that can take some time, but that's okay. That
Okay,
takes some
thank you.
time, but that's okay.
Master, please.